checked doctor's orders, gathered my supplies, provided privacy, ensured adequate lighting, made sure the bed was locked. Go into the room. Hi, I'm Ivey McRory. I'm a Cedarville nursing student, and today I'm going to be taking care of you. Before we get started, could you tell me your name and date of birth?
Mary Smith, 1998.
Okay, Harry, thank you. So today I'm going to be placing an NG tube. I'm just going to go ahead and raise the bed while I'm talking to you. I'm going to place an NG tube that goes through your nose and it'll go down into your stomach and we'll be able to feed you through that. I'm going to raise the bed and put you in a position that'll help. But before we get started, do you have any questions? This should take about 10 minutes or so. It will be a little bit uncomfortable, but I'm going to try and make it happen as quick as possible. And if you need me to stop at any time, just go ahead and let me know, or if you have any questions. I already prepared my tape. Easing you up. I'm going to pull these down just a little bit so I can listen to your bowel sounds. My hands. Just going to listen to your bowel sounds real quick. And bowel sounds are present in all 4 quadrants. There. Put a towel over your chest to keep you clean. There's a cup of water for you in case you need to swallow. My gloves on before I touch my tube. Not doing anything yet, I'm just preparing some stuff. I'm going to go ahead and measure my length. So from the tip of your nose to your ear to your xiphoid process, I'm going to place a piece of tape here just so I have it marked. So here's a cup of water in case I ask you to swallow. If you need me to stop at any point, if you could just raise your left hand and I can stop if you're feeling uncomfortable or have a question. So I'm going to go ahead and insert my tube into the lubricant, 4 to 5 inches, and while that's there, I'm just going to go ahead and take the pillow out from behind your head. It'll help me insert the tube a little bit better. So, lubricant on my tube.
Wait, that was good, right?
And before I started, I went ahead and checked the patient's ability to cooperate, the most patent areas, which I'm going to use the right one. Yeah, the right one. Then I use a tongue depressor to check the gag reflex. So lubricant on my tube and tape. So I'm going to have you put your head back, and then we're just going to get started. Go ahead and swallow for me. Would have you lean your head down, but can't with these mannequins. If the patient were coughing, we could withdraw, have them breathe, and start again with them swallowing some water. If it coiled, I could pull it back out and try again. Just going to go ahead and secure that there. You're all done. You did a great job with that part. So now I'm just going to check for placement in a few places, and you don't have to do anything but lay there, okay? Audible bubble.
All right now.
I'm going to send you for a chest x-ray to verify that placement, make sure it's in the right spot. I'm going to go ahead, so all the placement is good. So I'm going to go ahead and secure this. your nose and just wrap it around. You did a great job, and the hard part is over. Get that off your cheek. No safety pin. I would safety pin this too. They're closed, but I'll just go ahead and stick it there. So now the NG tube is in place. I would make sure the patient's doing well with that. Hook it up to GI suction or their feed. Provide oral care every 2 to 4 hours. And let me grab my formula. Provide oral care every 2 to 4 hours. And just check on them, put them in a comfortable position with Fowler's. The best, put them back down, but I'm going to go ahead and feed them, so I'm not going to do that. So I would check physician's orders for the feed, get my formula, make sure it's not expired and it's at room temperature. Good. Let's go ahead and place this back so they're a little more comfortable. If I was doing a G or J tube feed, I would check the incision site and placement of it, make sure it's all good, no signs of infection or any problem. Since I'm doing NG feed, I'm going to check the fixation devices and make sure they're still intact and replace any of the tape or anything if necessary. So I've got this, I've got some water in here. Go ahead and place this just in case, to keep our patient comfortable. And I would explain this to them before I started any of this. I would, hi, I'm Ivy again, and I'm going to be giving you a feeding through your NG tube before we get started, just to make sure, name and date of birth. Alright, Harry, well, like I said, I'm going to be feeding you. Should be not a problem, you can just lay there. If you experience any cramping or any pain while I'm doing this, just go ahead and let me know, and I can slow it down, or we can see what the problem is and solve it. So, before I actually do the feeding, I'm going to make sure they have bowel sounds. I'm going to listen again. And you're good, Harry, so we can go ahead and feed you. Gotta check one more thing. Put this back down. Pull out my gastric contents. If it's 150 milliliters or more, then I would hold the feeding and call the doctor, but Harry has less than that. So Harry, I'm going to place these back and then we'll go ahead and get your feeding started. Crimp my tube. 30 mils of water. You ready, Harry? I'm just going to flush the tube with that. Alright, here we go. Some feeding. Can slow, make this go faster or slower depending on the gravity. If it starts cramping, I could lower it and slow it down. I'm not going to let any air get into the tube, so continual fluid in here. Flush it with 30 more mils of water. Alright, Harry, we're all done. How are you feeling? Glad to hear it. Just going to go ahead and put this back. I'm going to leave you in this position for about an hour just to make sure we don't have any, you don't start feeling sick or anything. I can go ahead and take this from you. I'm going to monitor the patient and everything and make sure he's doing all right with that. All right, Harry, I'll be back later, okay? So now I'm going to remove Harry's NG tube. So check doctor's orders, make sure, gather my supplies. I'll need a towel and a tissue perhaps for Harry. Hey Harry, I'm Ivy again, Cedarville nursing student. I'm going to be removing that NG tube. It's a glorious day. It's going to be much easier than when we first put it in. It shouldn't be painful at all. If anything, it'll feel good. But before we get started, I've been calling you Harry, but can you tell me your name and date of birth one more time? Awesome, Harry. So, I'm going to go ahead and get my tube. After my feeding, I would have cleaned the bag out or the syringe or whatever. Go ahead and get my air to flush the tube. Alright, I'm just going to do a couple housekeeping things to make sure that this comes out correctly. I'm going to place this on you so I can throw that away when we're done. Okay, my syringe. There it is. Crimp tube. Just gonna flush some air in there, clear the tube out. Make sure I don't pull anything out onto you. Remove my fixation devices. Alright, Harry, I need you to take a deep breath in and hold it so that I can pull this out and then we'll be done real quick, okay? 1, 2, 3, hold your breath. All done. I'm gonna throw that away and you won't have to look at it again. So, monitor the patient's GI function, document the procedure and response, and if they had any complications. Put this here. Harry, if you need anything, you just let me know. I'm gonna go ahead and lower you back down. If you have any problems, just call me. Is there anything else I can do for you right now? No? Alright. So I would wash my hands and put all my supplies away. And in between each go, when I started it, I would wash my hands and check everything and ID him and introduce myself like I did. So I'm going to put this back down, lay his head down, and that's it.